Right. Assalamu alaikum, dear viewers. Today we have our very special guest with us, Dr. Muhammad Ali Qureshi, who is cardiologist. We will have a detailed chat, a lot of questions with Dr. Muhammad Ali about the cardiovascular diseases and how we can prevent from them. But let's start, from the introduction. Sir, welcome to our show.
Thank you very much. I think first of all, I would like to really thank. I have been involved in a lot of activities like you are doing now, and obviously it was a good opportunity, just especially for the Pakistan Youth Council, and you're working on a really good, uh, on a field, and that's really nice. Actually, when you talk to me about it, I thought it's really good topic, and it's quite dear to my heart. So as you said, obviously I have to talk or discuss about how to keep your heart healthy. This is obviously it's a bit controversial. I'm an intervention cardiologist. I want some people to have disease and then cure it, but I think primary prevention is the key, and it should be the future, and we should more focus on this primary prevention rather than doing advanced management and all this, especially given the Pakistani economic condition.
Right, very true, very true. Uh, let's start with, where were you born and then your early education, and then how did you proceeded towards the medical field and all?
Yes, quite interesting question. Every doctor say, obviously, I have got this. I was really inspired about this, but actually, I born in an educationist family in the city of Bahawalpur, which is south of Punjab province. And yes, well, I don't remember much my early childhood, but my parents said that I used to be active, curative, and curious, and a bit more communicative in my childhood. But they really admitted that sometimes I used to be quite grumpy as well. uh, yes, and my primary early education, primary and secondary education was in my hometown, Bahawalpur. And as I said, my both parents are teacher. They focus more on our uh, character building along with side of quality education, so that we can get ready for higher professional education. So I in 1999, what I remember, I moved to Lahore for medical education. I got admission in Allama Iqbal Medical College, and then I studied there for 5 years, uh, obviously medicine, and get qualified. Stayed about a year and a half here in Pakistan after my you know medical qualification and graduation. Did my house job here. Hello, can you hear me?
Yes, yes, please go ahead.
Yeah. So then I think it's early 2005. I moved to UK. Did my initial exams to get entry into medical register. And since that, I have been there. But I think after 1.5 years, spent some time there, and then after that, there was some problem in you know. You might remember some visa issues, especially for the doctors. I came back for a year and then went again. And I think it was in 2008. Since that, I have been there and did my general medical qualifications, MRCP exam, that is the membership exam, and got into the training there.
Wonderful, really amazing. Uh, please do tell us that, was it your kind of dream to become a doctor, or was it, something by the family that, there should be a one doctor in the family, कोई बीमार शिमार हो जाए तो चल एक बंदा तो हो ना.
No, actually, I really inspired by the doctor there, because obviously I remember when might be I was a 6 or 7 year old. I have been few times with my parent, especially my father, to the hospital to see one of our family member. I'm really inspired by the doctor, especially once I think I once or twice I visited to a coronary care unit, heart related unit. I was I was surprised because that was quite clean as compared to the other wards, and the people was quite efficient because of, I think, might be they were quite active. I really like, I mean, being a cardiology doctor because I got inspired. One of the doctor there, still remember the name. I think he was one of the leading cardiologists in Bahawalpur, Dr. Mustafa. And obviously his conduct and his dealing with the patient as compared to the other people, other doctors were quite good. I got inspired since that. And then obviously my father, actually they didn't say that you have to be a doctor, but they said you have to be a good person and get into a good professional, you know, qualification. Whether it's the not, I would say, just, people say either you have to get a doctor or engineer, but not like that. But obviously they want they wanted us to get into in some good field which we like and just grow in that and go on the higher rank rather
Wonderful,
than just
really. That is really wonderful. This is something amazing, and what we really need as well as a human being, as you told, that the parents, they do matter a lot. And once the parents are educated and plus they are the teachers, then it is something called a blessing. And
yeah.
the thing that you talked about, becoming a human is a lot difficult task than becoming a doctor or engineer. So you are highly blessed with such parents who have really groomed you and plus supported you in the education. Before we go to today's topic, I would like to listen some your feedback on the word you used, character, because in Pakistan, when you talk about the character, majority of the people just go towards that a relationship of a male or female, but otherwise it is a huge subject. And even when you talk about developed countries, so it is being taught that how to have the character building, what is character building. So would you like to share your own experience, your own
Yeah, obviously
observation on
it
this,
starts,
please?
yeah, obviously, yeah, the character building starts from your home, actually. Especially you should get a lot of, get absorb things from your environment, especially when you're just in a home, and later on obviously in your schools as well. Because in Pakistan, unfortunately, we don't focus on the, I mean, practical things. We do tell them that, and speak always truth and all this stuff, but we don't do practically because it's a contradiction of what we say and what we do. That's the problem, especially in our homes and on schools and all this stuff. And when we read our, I mean, read about our heroes, our Quran and Hadith, we we say these are right things. We actually don't follow them. That's the main difference. And I believe these things are very, very important. As I said, because being a my parents being educationists, they knew about that, and they knew that if we make them a good person, they can do anything. And that's the right thing, because if you're really hard worker, always speak truth, punctual, and all the stuff, you can do anything in any field. You can do miracles. That is true, because that is the key of success. And you should be really, I mean, honest to your job, honest to your work when you're reading, or when you're just in the school. If you work hard and spend time in your, in your education and focus on right things, you can do whatever you want. But on the other side, if you just run behind the just um, uh, you don't get anything out of that.
Very true, very true. You're right, sir. And thank you very much, viewers. Today we have our guest with us, Dr. Muhammad Ali Qureshi, who is a cardiologist and has served mostly in UK, but nowadays he's in Lahore, uh, delivering his best to the people of Pakistan. If you have any questions, kindly do leave in the comment box. So in between, we can come back to your questions and we can answer. आप दोनों लैंग्वेजेस में सवाल कर सकते हैं, बल्कि यहाँ तो चार लैंग्वेजेस हो गई। एक तो आप इंग्लिश में कर सकते हैं, उर्दू में कर सकते हैं, पंजाबी में कर सकते हैं, और डॉक्टर साहब श्योरली मेरे ख्याल में सराइकी में भी आपको जवाब दे देंगे। तो
Yes.
यू मे you may ask in all four languages, but better as I just prefer, just
Mm.
because of keeping the things everybody can understand. We have the international viewers as well, so English and Urdu would be better, please. आप ज़रूर पूछिए सवाल, and it is always encouraged, and I welcome you all to the show. And those who will be also watching us after too, you can also leave the questions in the comment box, and we will try that. We will come back with the answer, sir. Let's start with the cardiovascular. We see that, in the society right now, all the diseases are forgotten. Like, it used to be that somebody has got a heart disease, people are running, someone have got, high blood pressure, someone have got a high diabetics, and so on. There was a list of diseases, and, the businesses in Pakistan, it's a business actually, I say, quite commercialized in Pakistan, the medical field. But since the COVID-19 is announced, Corona is there, I guess all the other diseases are on holidays. So let's start, but still we have to talk about today about how to keep our heart healthy. So let's please just tell our viewers about what is cardiovascular and what are the cardiovascular diseases.
Okay. So yes, it's really a good topic, as I said, because if I obviously there are quite few people are laymen as well. I want to just explain about first about the heart. Heart or we call cardiac. Cardiac mean heart in a simple language. So heart is a vital organ of our body. Obviously, it's very important, and this is a muscular organ which pumps the blood in all over the body, and this is connected to blood vessels we call arteries, the bigger arteries, and after being pumped, blood goes into the arteries and different parts of the organs and different organs, and obviously it supplies blood having oxygen and other nutrients. Can you hear me?
Yes, yes, please go ahead.
And the blood comes back through other special kind of vessels we call the veins. So when this heart get unwell, like if they have a problem like in pumping, then obviously, or if functions get impaired due to many causes, we got heart disease. So if I explain about the heart, because every part, every organ get a blood supply, heart also has a blood supply. The arteries that supply to the heart muscle itself called coronary arteries, and we call, if there's any problem with the arteries of the heart, we call coronary heart disease. uh, Actually, the main mechanism of having a coronary heart disease or problem with the arteries of the heart is the deposition of fatty material, inside the arteries or vessel of the blood, and that get, gradually worsen, and you could get a clog up or blockage of the arteries. Once your arteries get blocked, you can get a heart attack. If it's a narrow into extent that blood supply towards the heart muscle is compromised, then we call angina, like you get really compromised blood supply and you get pain in the heart, which what we call angina. Most of the people know about the angina, like it's the rectus tunnel, behind the sternum or behind the, your breastbone. It's a pain. It could go anywhere, like into your neck or into your arms or into your back. And with that, you could get like sweating and other symptoms, which tells a clinical person that this person is having a heart attack. To detect a heart attack, one thing is just to know about the symptoms, and other thing is you could get as soon as possible the ECG, which tells you about the heart attack as well, because obviously you can get electrical activity on that ECG. Is a tracing, on a paper. There's some changes in the ECG, and you can detect. The other way, and the other additional thing which tells you that you have got a heart attack or problem with the heart is that one of the heart enzyme get raised as well because of the damage to the heart muscle if it's a prolonged.
Right.
So
That's
this is a one. This is the only coronary heart disease which is more prevalent as compared to other heart diseases. But the other heart diseases are like any problem with itself muscles of the heart, like your heart get might be thick, more thick due to the problem like high blood pressure, or you might born with some thick muscles of the heart. We call them a special disease. And sometimes obviously your heart muscles get dilated as well and they don't pump well. We call that disease cardiomyopathy. And if it's dilated, we call dilated cardiomyopathy. When you get these diseases of the heart muscle, you get a heart failure, you know, when the person or the patient can't breathe properly, they get sometimes swelling in the legs, and they can't sleep sometimes if they have a severe symptom in the nighttime. Lying flat would be a difficulty as well. And some other way to detect that, imaging and ECGs, as I told you before. And the third thing is any problem with the rhythm, because obviously heart itself have electrical channels which makes your heart beat. If there's a problem with that electricity of the heart, like it could be very slow or it could be very fast. So these are the other things which can make your heart to not pump blood. If it's a very slow heartbeat, your heart is not pumping enough blood to get into the body. And what will happen? It won't go into the other organs, multiple organs. You get decreased blood supply, especially if it's towards the brain, then obviously you can get unconscious. Same happens when it's really fast heartbeat. Your heart is unable to pump enough blood, and you could have unconsciousness. And if it stays for a longer period of time, people could die. So if I summarize, so three major kind of problem. One, with the structure of the heart itself, as I told, muscles might be valve, and other, the problem with the blood supply of the heart, as I said, coronary heart disease, any problem in the arteries, which call atherosclerosis, deposition of fatty material. And the third thing, problem with the rhythm, heartbeat itself. It could be slow or fast. Both are dangerous. Everything in moderation is good.
great. And you have really tried to illustrate and elaborate quite in, such a easy way that a person who is not relevant or related to the medical field can also understand that what are these three main kind of diseases relevant to the heart diseases. Dr. Saab, we have also, especially in Pakistan, another kind of heart disease that mostly people are very emotional when you say both sides. One side of emotions is that you find people getting aggressive very quickly. You see
Yeah.
in everything they will just run out. They are ready to fight, they are ready to argue, they are ready to criticize. And you may start it from a hawker, and then you can go from top to bottom. Everybody can do it. Second is, now first I would like to listen your comments on this, that how this aggressiveness destroys and creates the heart diseases. Does it really have a link with that blood pressure, that we increase the blood pressure and it affects our heart? How do you see it, please?
Yeah, it's a quite good question. Yeah, actually, frankly speaking, stress itself or being angry itself does not do anything with the heart, but there's a mechanism behind that. When you become more aggressive or if you're angry, then obviously at the same time you get your blood pressure used to be a bit higher, and there's a release of some vasoactive and a bit more hormones, what we call adrenaline, when you are doing exercise or a bit aggression or anything like really in excitement, your adrenaline levels goes very high. This is a hormone which causes your heart to work more. Like it causes your heart a beat more, beat stronger. And other thing is that circulatory system, blood vessels get squeezed and your blood pressure goes high. So the three things are happening here. One is your blood pressure is high. Your heart has to pump a bit more against a high blood pressure. The second thing is that your heartbeat is very fast. There's a more workload on your heart. And yes, due to that disease, if you have underlying problem like any heart failure already problem with the arteries of the heart, that could get worse in short term. If you have a, let's say if you have a fatty deposit in your heart arteries, when your heart blood pressure goes high, your heart is beating a bit more and your heart is pumping more blood and has to work hard, then it needs more blood supply. And the other thing is, due to high blood pressure, it would be high blood pressure inside your arteries of the heart, and that plaque or that fatty deposit get dislodged. And it get dislodged, it goes into the distal circulation or in the distal part of the arteries, the smaller arteries, and get these arteries can get blocked. One thing. Another thing, we have a quite protective mechanism. When there's a bleed or anything, there's a body has to block that bleed or block that damage. And you might have heard about the clotting mechanism. We have got in our body the platelets, they play a role in making a clot, and there's a clot there in the artery that your artery could get blocked and you can get a heart attack. Yes, in that terms you could say your aggression that make your heart worse, but in real sense, no. The other thing is that with the aggression, depression, and these things make you a bit unhealthy in a sense. If you have depression or aggression or abnormal behavior, you might be doing not a healthy lifestyle. Like you might be eating a bit more, might be putting weight, and all sleeping sleeping late in the morning and not doing much exercises and all this stuff, because this aggression is a kind of a symptoms which tells you either person is not happy, is depressed, isn't it? Or have some other might be psychiatric problem in which you are not taking care of your body. So this is today's topic is very important. We have to focus on our healthy lifestyle and focus on the primary prevention, focus on the risk which can cause the heart problem.
Very right, very nice, and thank you, Dr. Muhammad Ali Qureshi Sahib. Uh, we'll be continuing our program with a lot of questions coming from audience as well. I would request you all who are viewing us kindly do subscribe our YouTube channel. You are just watching this live show from, and press the bell icon so you can have the future programs to be informed as well, and you can definitely join them too. So please do subscribe and press the bell icon. Here we come with some of the questions one by one. This is a comment more than a question, I say. Absolutely right, sir. Practical needs to be focused more than theories. We are lacking a lot in practical skills than modern countries. Yes. Hamad Shah says that we have more theories and less practical. So
Yeah,
uh, I guess,
actually, yeah,
please.
practical in a sense, I think, because obviously we are lacking here, not with the procedure skills. Obviously, I have been everywhere. So being obviously I have been from here. We have a good, you know, procedure skills. Yes, I absolutely agree with that. The people like surgeons and obviously intervention cardiologists, they have a good techniques, and also we can compare our surgeons or our intervention cardiologists and other interventionists with any part of the world. But what we are lacking, I think, is it's a professionalism and ethics. If you say that is a practice, because what we learn in our books or in our ethical books or in our like Quran or any other subjects, we always say that we should help each other, the doctor should be polite and all this stuff. What we learn in our medical schools a bit like like in a way of theory, but did not do a good practice. That is the main difference, because your attitude towards your colleagues, your attitude towards your, your trainees, your juniors is different here as compared to the West. And that is more important. I believe the person who was saying that we are not doing more practice, they might be referring to that. The other person was saying we are good in practical things, might be he was referring to the like procedure skill, like we have a good surgeons and all this, we're quite brave. Pakistani nation is quite brave, we can do anything, like although we are not doing very well in cricket at the moment, but obviously we have done a lot of miracle. We remember when I have been to UK, they are, oh, you are from Jahangir Khan's country. The people still know him. So he just, better than me. He won 500 consecutive games. It's not an easy task. I, I,
Amazing.
I don't think that anybody else can do that. It's just perseverance and persistence. Yeah, we can achieve that. Or what we were lacking, I think, especially in the medical field, is a professionalism, medical ethics. Is very, very important. It's not like any regulatory body can improve these things. Yes, with the stick, we can learn something, but obviously we have to change from inside. There's a difference between a wise person and intelligent person. Intelligent person know that we should change you know we change the people. It's right thing to do, change the people, to know that we should get them changed. But obviously the wise person, what he thinks, he want to change himself first from inside. That is a real change, and that change we want here in Pakistan. Those who have been abroad, we always talk about Pakistan and all this stuff. I think this is a time, and that is the age group in which I am now. This is a time I think we should contribute to our country. We should come back. We should participate in different activities. As I said, we should more focus on the primary prevention, not in cardiology, in other things as well, like in obviously a lot of infectious diseases. We are still trying to eradicate, polio, and obviously it's quite prevalent. We have got hepatitis B, C. We are fighting against that, and obviously there are a lot of kidney problems too as well. So we have to focus on that. We have to prevent to before it just born. So that's the more important. And obviously with the dedication, without any dedication, without any professionalism and medical ethics, because we have to train our juniors to focus on that. And of course, we have to deliver these things to our community as well. This is obviously this is a teaching, and the medical teaching, and creating a medical awareness is a doctor, responsibility. It's not a responsibility one of the singer, one of the social worker, and also they can do, yeah, they can help us, but obviously being a doctor, you can focus more on that. That's the main thing. We have to educate our youngsters as you are doing. I'm really pleased that you have done a great job, especially I have listened just recently, I think it was yesterday, you had talked about Kashmir, focusing more on the youngs, because obviously, as we know, we have one of the youngest nation in the world. So we have a future. Inshallah, we will get through there.
Inshallah, very nice. Dr. Muhammad Ali Qureshi, now before going to the next question, I would like to add up, as you said, that definitely when one side is professionalism and the other side is non-professionalism. When we observe, the hospitals of Pakistan, especially I'm talking about the public hospitals, one thing really disturbs a lot all over the country. I guess hardly any area might have left from me actually from visiting and meeting and interacting with the people of different walks of life. One thing hurts really, that is, too much politics in the field of especially medical, that everywhere you just feel like sometime when you are talking to a professional doctor, you feel like no, you are talking to someone, a legislator, you're talking to an MPA, or you're talking to a union leader, or you're talking to someone who is just fine. I agree with it. Just a short kind of remarks. When we visit, for example, you visit Europe, you visit Africa, you visit America, you visit, the Arabian countries, all these Arab countries, you don't find this thing there. But here, everything, especially right now, I'm focusing the medical field, that, our doctors, they focus less on professionalism and more on the politics, and especially when we are talking about our young blood. So what would you like to comment on it, please?
So I belong to a I mean, obviously, the doctor community. I know about ins and outs, but there's a two side of these comments. One is itself, when you're a doctor, you see things in a different way, and when you are one of the patient or as a neutral, like one of the, you could say, reporter, one of the anchor person, you say what you see. I mean, on the TV, you just narrate that. So actually, the problems in Pakistan is not like only the ethics, medical education. There's another thing as well. What we say, because when I was here, because obviously, doctor here has to work really hard. The salaries initially when I was doing here, I think still I'm not sure whether still the salaries are good or not. But what I can tell you at that time, definitely with the surety, I can tell you the salaries was not good. They were doing day and night the duties and all this stuff. The junior doctor, what I'm talking about. So that is the one thing, because obviously they get involved into the politics, because one thing, obviously they were working hard, they were not getting a proper training, not getting a proper salary. If you compare the education of a young doctor, as compared to the other people, because you can get earn more money like in other fields. I'm just talking about Pakistan, not the other country. And you can earn more money if you spend time in education or training or qualification as compared to doctor. As a doctor, you have to spend 5 years, you have to spend your money, time, and most of the doctors, they just only doctors. They don't do anything else because of the burden of the education, obviously, and obviously they're because they're dedicated, because the qualification is very tough and hard. You have to work really hard day and night before getting to the medical profession, and 5 years training is very, it's very tough. So what I see, the problem is not only doctors. Yes, when as a junior doctor, I don't think there's any problem for anything with the junior doctors. They are not getting into politics initially until this, because they were not getting much support from the senior doctor. What I would say, because obviously I know when your practice is established, it's okay, but when you are just doing your training, that's the more difficult part. And that part is important, that you should get a good training, not in, as I said, in the medicine field, but professionalism. What you see the other doing, like your senior doing, you do the same thing. So that is the problem. Obviously, government has to focus more on that. They should increase definitely the salaries of the doctor. If we compare the ethics and all stuff, we should compare the salaries and other perks and privileges as compared to the world as well. Because when you go outside, you get good salary, you can feed your family, and obviously you can save some money too as well. So, but this is not in Pakistan. Those, I'm not sure, it's unfortunate, because people have their own choice. All the doctors can go outside. It's not a problem, because you can go to the Saudi Arabia, you can go to Dubai, you can go anywhere. The people I know who stayed here, they will have some reason. Might be parents, might be they wanted to live in Pakistan, didn't like Western countries and all this stuff. So that is the important thing. I would stand with the doctor community in that, But yes, I think it's just the responsibility of, I would say, the government as well, and those who have already, I think, received their higher qualification, and they don't have a problem like any financial problem. When you become a qualified doctor, then obviously you start some earning, and this is the time when you should support your junior doctors. You should speak for their rights, you should speak for their salary, and you should tell them about the ethics, because have to have to do that. If you don't do that, then yes, the junior doctors will get into the politics because they have no other choice to fight for their rights. So I'm not a junior doctor, but still I will stand for my junior doctors. So
Great, great. And this is really a very, very strong point of view. I wanted the same thing that see, we see the one side of the picture, and we do need to know the other side too, that why is it happening? What are the root causes? And definitely, till the root causes are not being eliminated, we cannot have, the proper results. Thank you, sir. Coming to another question we have from Maria Jabin. She asks how to identify heart attack and how early we should take someone to hospital.
so as I said earlier, then heart attack mean is a problem with the arteries of the heart. We call coronary artery disease. And when the person is having a heart attack, it means their blood supply towards their heart muscles through that coronary arteries is compromised. Okay, it's a compromise to an extent is completely. If it's a completely blocked, then we call is major heart attack, or in medical terminology we call ST elevation MI, acute MI. So if the artery remains blocked for few hours, then the part that's supplied by that artery, will get damaged, and this damage is irreversible. So if I elaborate more about the heart, we have got three major arteries of the heart. One art, one artery is by right of the heart. We call it right coronary artery, and the artery that's by front of the heart is called left main stem, or left, you can say, a motorway. And then it gives two branches. One run on the front of your heart called as left anterior descending artery that supply the major part of your heart. I would like to say probably 50% of your heart. And the other branch of that artery, on the left side, supplies back of your heart, that supplies 25% of your heart. So as we said, when these arteries get blocked or get compromised blood supply, you get chest pain because your muscle is not getting blood supply. And the other feature you can detect, you might get sweating, feeling a bit nauseated, unwell. You could get a problem with the rhythm of your heart, and your heart is might be beating very fast. Or if the one of the artery that supply the electrical system of the heart is get blocked, and you could have a slow heart rate too. So when it happens, now what will happen if you don't do anything? So you have to unblock that artery. In old days, when it still happens in Pakistan as well, you used to give a blood thinner, you can say, a medication that dissolve that clot. But again, when you give that, we call streptokinase or another medication we are not using here that we call TPA. Might be, I think, two. There would be a lot of. I don't want to speak about more about that. This would be more medical terminology. But what I want to say, we were still giving these medication to dissolve that clot so that we can get unblockage of the artery and blood supply towards the muscle is get restored. But giving these medication is not 100% surety to that your arteries will be get properly unblocked or the flow will be restored. You can, the other way is doing that, which the world is doing now, is the primary angioplasty, in which when you get a major heart attack, the patient goes directly to the cath lab. Cath lab is is the operation theater, in other words, for cardiology people, where you look on the arteries of the heart. Either we go from the wrist or from the leg and look on the arteries. If there's a obvious any blockage there, we can unblock that artery initially with the balloon and putting a stent, which is a metal meshwork there, and obviously your arteries can restore. So the important thing is that to first identify the heart attack, which cannot be identified only the major heart attack, what I'm talking, like when your artery get blocked with the symptoms. And the most important thing is doing a ECG, the tracing of the heart, which differentiate between the minor heart attack and major heart attack. In minor heart attack, you can wait because your artery is not completely blocked. It's just blood supply is only compromised. Your myocardium is not as much danger as compared to completely blockage of the artery. So you could wait for that. But if you have a major heart attack, this is real emergency. If it's not get unblocked within a few hours, I would probably 8 to 12 hours, then your heart muscle can get dead. And if it's an artery that supply 50% of your heart is get dead, then you can imagine your heart would not be pumping much blood, and you will get in future heart failure and get into the trouble. Like every time you would be walking, you will get short of breath. You might get fluid in the legs, and other problem which is quite dangerous, could be quite dangerous, is the you know rhythm problem. As I said, you can get really abnormal fast heartbeat. We call ventricular tachycardia or ventricular fibrillation, and obviously there's some treatment for that as well.
Right. Great, sir. Let's have another question from Fatima Qureshi. She says, Assalamu alaikum salam. My question is, what is the link between smoking and heart diseases? Yes, this is something really very important because many countries have even banned smoking in the public places. So, how do you see this link between smoking and heart disease?
I believe is smoking a single most important risk factor for the heart disease, what we call the coronary heart disease. We know about the smoking has a dangerous effect on the other part of the body, but if we focus on the heart, it can cause coronary heart disease. You know, with the smoke, you can produce three things. One is carbon monoxide. This is not a good, good gas which goes into your lungs and goes into your heart. Other, you inhale the tar, which is inside your heart. And the third thing is the nicotine. The most important thing is that, you know, tar, tar and carbon monoxide, which can damage the, cells inside the arteries of the heart. It can damage any arteries of the body which supply the blood to different organs, but especially, the arteries of the heart get damaged. And also it could damage the other arteries, especially the brain arteries as well. So once you get a damage to the artery due to this carbon monoxide, you have prone to have more fatty deposits. Even though you have a normal cholesterol level or fat in your body, still you could have a deposition of fatty material, and you would end up having an atherosclerosis, narrowing of the heart arteries. Can you hear me? Hello? Hello?
Welcome back, sir. This is the, you can say, beauty of, technology that we have to learn from. Please
Yeah, sorry.
do
You
continue.
get so. So as I said, is the three things with the smoking can cause. One in carbon monoxide, as I said, tar that could damage the lining of the arteries of the heart, and you get a fatty deposit there and narrowing of the heart. That is more contributing factor. And third thing is the nicotine, which make you more addicted towards the smoking, make you a bit more relaxed. And with the nicotine, you get a bit more fast heart rate and all this stuff, and that contribute to uh, for the heart attack. So it's the important thing is just stopping. I think stopping smoking is very, very important. If you stop smoking after 1 year, you can reduce your risk of coronary heart disease about a half. Can you hear me?
Yes, yes, please go ahead.
Yeah, yeah. You can reduce to the half. So that's the major risk factor. And obviously, in Pakistan, I know the youth is more indulgent in smoking nowadays, and it's very important. That's the reason I was asking you that you should focus on the healthy lifestyle. Like smoking is the first thing, and we have to cover the primary prevention. For the primary prevention, other things as well. That is a sedentary lifestyle, because nowadays we are not doing much activity as compared to the past. We are using our bikes, cars, and all this stuff going outside. So we are not doing any more cycling. Either it's just for the work or just even though for the recreation, we are not using that. I think we should just do that. And the other thing is that we need more gyms, parks in the country, so that we can just get some space to go outside to jog. And we should, I think, promote more cycling as well in in Pakistan. Now, other thing is not only that you can do, just you have to spend much more time on that, because if you're doing a work in an office, you can get spare 10 minutes only. You can do a brisk exercise, or might be treadmill over there. And I have heard about quite few I mean workplaces, especially multinational company, they have got the gym there, treadmill, uh, elliptical, other exercise machine, where just you can do it for 10 minutes to 30 minutes. As you know, standard or recommended physical activity to keep your heart healthy is about 150 minutes in a whole week. So in other words, you should do at least 20 to 30 minutes every day exercise, and it should be in the bouts of 10 minutes. 10 minutes you do a brisk walk, a cycling, or swimming, or any other kind of exercise you should do when you feel a bit more warm and your heart goes like a bit fast, like I would say I do 130 to 140 heart rate. That makes your heart healthy, your muscles get healthy, and it's repair any damage which has been caused by other risk factor to the arteries of the heart as well. And
The,
the third thing
the
we are the third thing we are having in Pakistan, other than we know high blood pressure could cause coronary heart disease or diabetes. We know, everybody knows about that. But what we miss is the smoking. As I said, family history we can't change. The third important thing is being more overweight, because there's two things. One, obviously, we don't have any healthy eating habits. And other thing we have already discussed is a sedentary lifestyle, that not doing much activity. If we focus on reducing our weight, it will help not only coronary heart disease, but other problems. Like you could improve your blood pressure, diabetes, and these in other terms will reduce the problem with the heart. So we have heard, you might have heard about the healthy lifestyle like Mediterranean diet, where you do reduce your carbohydrates, eat more proteins like pulses, beans, or oily fish. Could be chicken, but not mutton and beef. And cut down your carbohydrates. What is like starch, like our chapatis and rice. We should cut it down, because what I see in our country, we are taking more carbohydrates. And important thing is that we are not focusing much on the fruits and vegetables. I know fruits are costly here, but obviously vegetables are not. We should take 5 a day, including food and vegetable. I would like to say about 400 grams of food, of fruits or vegetable we should eat. We should eat 5 different vegetables or fruits, a mixture of that, if we could do. And the third thing is to cut down our fat. You know, fat is most important thing because as I told you earlier, if you have a high cholesterol or high fat in your body, it will deposit in your arteries, so you have to cut it down. In the fat, there's two fats. One is the saturated fat and other is the unsaturated fat. And saturated fat is really bad for the heart. So saturated fat is in the cheese, what we eat in burgers and all this stuff is not a good thing. Ice creams and palm oil, coconut oil, these are not good. In other words, I would say that the fat which just gets solid, which is not liquid in a room temperature, is a bad fat. The fat which is like oil, the other oil like olive oil is a good, and vegetable oils are good, is fine. Obviously, you could get some fat in your chicken or in your fish. That is a good fat. In fish, rather, we get omega-3 fat. That's good for the heart. So it's very important getting awareness because that should be a focus of our prevention. That we should just talk more about the things on which we don't spend much money. We it's fine. It's not like taking a medication is the difficult. You have to spend a lot of money on that. So before we get into trouble, it's better to just cut it down there. And the third thing, as a third and fourth thing, as I said, obviously high blood. If people get a high blood pressure, they should get it controlled with exercise and weight reduction. Same for the diabetes as well. This diabetes is the big risk factors. We can control if we get a good control of the diabetes. We can reduce the heart diseases to more than 3 times as compared to the people who are having uncontrolled diabetic. You know, can you hear me? I can't. Hello.
Yes, yes, I can hear you, please.
I'm sorry. Yeah, you can hear. So, good diabetic control is is good. Keeping your blood sugar wi- within normal limits.
Great. I guess everybody is enjoying it and understanding, and every precaution can be taken very seriously. But here I would like to share with you about the chapati, roti, and
Yes.
especially how it has the connection with our people. That when I was visiting Scotland, I met a friend. He was also, I think, doing his PhD, and he was enrolled somewhere at the St. Andrews University. So we met, and he told me very interesting thing. As soon he met, he told me, "भाई, 3 महीने हो गए मैंने रोटी नहीं खाई." So I got little bit, uh, just shocked as well. So I thought might be he's having any such kind of problem, financial problem, or so I asked him that any problem with you? He said, any financial problem? He said, no, I have got the Fulbright scholarship. I'm receiving a lot of money. And even I save every month. I send back home as well. So I asked him, फिर यार ये रोटी कैसे? So he told me that मैं ज़्यादातर fish and chips, चावल और ये चीज़ें खा रहा हूँ. रोटी तो इधर मिल ही नहीं रही है. So about a
Yeah.
relationship with roti is very high. I don't think
Yeah,
so.
I know.
इसको
I know.
कम
Is
किया
obviously. Yeah, yeah. I'm just saying that we should try to cut it down. It's not like you should not take at all. Because if I tell you about the healthy lifestyle, we should have a 1/3 portion of carbohydrates, including roti and chapati and rice, and 1/3 fats and 1/3, as I said, the proteins. That is the in broad in broad terminology is a healthy diet.
That's great. So, Fatima Qureshi, what dietary changes can I make to reduce my heart disease? I guess Dr. Sab has already talked about it quite in detail, and it must have answered your question here. There is a one technical question, I guess, from Mr. Hamad Shahid again, he says the pacemaker device is beneficial in long run, or we should opt for heart transplants.
The pacemaker, obviously, I could not understand in properly that question, because whether they're talking, because pacemaker is only required when your heart rate is very slow. So yes, if the heart rate is very slow due to, as I said, electrical problems, and the patient is quite symptomatic, yes, you need a pacemaker. And for the heart transplant, it again, not every heart transplant patient should get a pacemaker. But if there's a problem, then definitely they will get that one.
Great. So we
But
have a
nowadays, yeah,
please do continue. You should
yes,
complete.
I finished. Yeah, I finished. Yes.
Okay. So we have again here Dr. Fatima Qureshi. She says that are the symptoms of heart attack different for women? One thing let me
It's
just add here. This is something the statistics show as well that internationally, worldwide, women get the less heart attacks than the men.
yes, yeah,
Question.
yes, you're right. I can tell you about the American study, recent study, because obviously, if because it's more prevalent in America, everywhere in developed country as well. I will tell you about the statistics. I have just read recently a paper. They were saying that obviously in the next, I mean, decade, the people who are the male who are in 40s, there's a chances that 50% of the male population after age of 40 years, they will have had a heart attack in future. They will have a heart attack in future. As compared to the male, the only one third female have. Yes, it's more prevalent in males. I can't explain exactly because might be other things like being a male and female, because obviously male might not be observing, I mean, healthy lifestyle. In other words, obviously, in Western country, they might be drinking a bit more as compared to the female, not doing much exercise and all this stuff, or especially the diet wise, as I said, might be eating more, fat or saturated fat as compared to the female. And of course, there's other thing is that obviously genetics are different in the male and female as well. But I believe more is with the lifestyle rather than genetics. The symptom, there was a question whether there's a difference in the symptoms. I don't think there's a much difference, but might be, I think the female or the women, they might not be telling much about the symptom. It depends on the different socioeconomic, groups. Some female are quite sensitive. They, if they have any problem, they just shout a bit more. In some socioeconomic, group, the female don't speak much, or they feel if we just make make a more voice, and nobody will listen to us, and they just keep things to them. So it's a different. It's my personal observation as well. Obviously, the I don't want to, I mean, didn't want to tell, but obviously, there's a question, so I have to answer that. Like, I remember when I was working in a cardiology department as a hospice. If the if the person if the male person comes with any heart problem or requiring for the pacemaker, the family used to get these things done very quickly. Like spending money was not a problem for the male, but I remember for the female, we waited few weeks to get it sorted, and sometimes we have to do ourselves, like we have to collect our money or just ask other people to donate some money so that we can get it done. It depends upon the different socioeconomic category and different groups, what I would say. But frankly speaking, there's no much difference. But sometimes there's a few tests are false positives, especially the exercise test. When we do in females, it comes false positive. In other words, it's not positive, but it's showed as a positive. And obviously, it's difficult to explain.
Great. But one thing is learning here as well. The heart matter for both men and women are same. It is not
Yes,
like that they have the different kind of symptoms. Whatever the heart matters are, they need to be taken very seriously. And
yeah,
as Dr. has already mentioned, we need to take care of our lifestyle. We need to take care of our nutrition. We have to take these things seriously before we, face such kind of challenge, because they say that prevention is better than cure. Thank you, sir, for answering very nicely. Another one, I'm going to actually announce that Fatima Qureshi is going to be our assistant for the medical relevant interviews of future, because she is helping a lot. All the questions I had to ask you, she has been keep asking. So, what is the difference between angina and a heart attack?
Yes, for the layman, angina, I mean, as I said earlier, is if you get a pain due to the heart problems, like due to arteries of the heart, is called as angina. And heart attack, it doesn't mean whether you have got a heart attack or not. When when in other in layman terms, you call heart attack when the arteries are get either completely blocked or compromised to an extent that you are having ongoing symptoms, like you are just having a prolonged episode of chest pain, then you will suspect a heart attack. In simple terminology, we call is a simple stable angina. Angina mean when you walk, you get chest pain, you stop, you get relieved. This is called stable angina. But in heart attacks, you get ongoing chest pain, probably more than 20 minutes or something. It means that your arteries has compromised to the extent it's not getting better with the rest or with the medication. You have to get some medical advice, especially the cardiology input. And you have to see a heart doctor very quickly and on the urgent basis. The people who comes with a heart attack, they have to stay in the hospital. The people who have a stable angina, they can go back to their houses, go back to their work again, but you can treat them initially with the medication. If they are not getting better, then you could do something, as I told you earlier, looking on the arteries of the heart.
Great, thank you, sir. Uh, there we go. We have another question from Rian. He asked that what is the role of exam stress on students, and does it affect the heart as well? Let me make it more relevant. And as you already have
Uh,
talked about the stress and depression and these things, they do affect the
yeah,
heart.
y- yeah, of course. It's as I said, not directly but indirectly. I explained about the mechanism. When you get stressed due to anything, like you can get stressed due to being angry, and also when your heart rate goes, your heartbeat goes fast, your heart has to do more work. And as I said, in the body, because there's a mechanism which releases the hormones called adrenaline, cortisols, and different kind of hormones, which increase your blood pressure and increase the workload of your heart. Yes, indirectly it could, but if you have a persistent stress, you're all time anxious, in long term, yes, it could affect your your heart, and it could worsen your heart problem that we have got already. Another thing is that the stress leads to the unhealthy lifestyle as well. As I said, people sometimes in the stress, people eat more, or people don't go for the exercise, for the walk. They don't fancy seeing friends, because obviously if you see friends, go you could go outside, you could you're doing something like some activities with the friends, you can do some games and all stuff. But if you carry on with the stress, you might get confined to your house, your work, and all stuff. And you other thing is that is important, because some people say due to the stress we do smoking. That is right. So stress is very important. You can say a risk factor or important thing we should always make a note of that we should getting rid of that stress. Like we should have a special kind of treatment for that. Either you can see one of the psychologists there to treat that stress, or one of the person who is more specialized in mental health, being and especially in Western countries, they are focusing more about the mental health issues.
Great, great. Uh, Dr. Muhammad Ali Qureshi is our today's guest. He's a cardiologist, having education from Pakistan and then the UK. He has done several courses, and I loved one thing that he is having an approach of lifelong learning. Continuously, he is trying to upgrade, trying to learn, trying to continue the studies. And this is what is required in any field, that we must be keep learning, we must be keep enjoying the learning so we can be upgraded version of whatever we are doing. Dr. Saab, thank you very much for today's session. We do have a lot of questions, but as I said, the session remained very successful, very interactive, and inshallah, we will be inviting you again and again, at least once a month, so we can listen more about the heart, how to keep our heart healthy. In the end, I would like to have one message for the people of the world, relevant how they can, keep their heart healthy and how they can be happy.
Yes, I think focus more on yourself. I would say, just I said, key thing is healthy lifestyle is the key thing. Focus more on yourself. Give some time, because obviously I know we all over the world, not in Pakistan, everybody is quite busy. Just space at least 10 minutes for yourself. Think about you, and do some activity, exercise. That is more important.
So kind of you. Thank you very much, viewers. It was really great to have Dr. Muhammad Ali Qureshi, a well-known cardiologist working right now in Pakistan. Uh, I'm thankful to you all as well. And in the last, there's a message, as I earlier said, that please do uh, subscribe our YouTube channel where you are watching us right now. We have another one, Hope TV International. You can see the logo in the corner. There's another our YouTube channel. You can subscribe them both. If you have any suggestions, what you would like to watch in the future, what would you like to hear from Dr. Muhammad Ali Qureshi and any other speakers and other guests and other topics, you may comment, you may message us. We'd be highly thankful and definitely will try to oblige. Thank you very much again, Dr. Sab, and looking forward to see you again.
Okay, thank you very much, Atiq, and
So thanks.
bye bye all of you.
Please stay with
Thank
me. I'm going to just end this broadcast.